Now, on Wednesday, hundreds of people marched to the Department of Health in Pretoria, demanding that government step up measures to deal with tuberculosis in South Africa. Protesters called for TB to be recognized as a national health crisis. Now, for more insights on this, I'm joined by Nqobile Shabalala, Capacity Building Coordinator at the Treatment Action Campaign. Nqobile, thank you so much for your time this evening. Take us back to Wednesday and tell us about that march to the health headquarters in Tshwane and what your demands were.
Yes, good evening, Masa, and your listeners at home. Yeah, our demand was very clear to the National Department of Health, including the Minister of Finance. It's more about the budget cut that was announced by the Minister of Health of Finance to say there's going to be a budget cut. We feel that when they do such budget cuts, it will affect the TB program in South Africa, the TB and HIV program in South Africa. So basically, when we marched to Pretoria on Wednesday, we're looking at 4 key things to say these are the 4 key things that the National Department needs to look at it and also address it accordingly. The first thing was about safeguarding the money for TB program, so that all the monies that are being allocated for TB and HIV need to be ring-fenced and not be used for other use or any other means. And the money that is being allocated for TB should not have any cut, but instead of having cut, there should be more resources being injected. That was our first issue. The second issue was to enhance accountability. If you look in 2022-2023 financial year, about 55,000 people or 54,000 people died because of TB in South Africa. It's so sad to see people still dying for something that is curable. So we need the government to account for this, to enhance their accountability around this, so that they meet the constitutional obligation around to say better health for all and access to health for all. So we need such things. And the third one was about strengthening decision making. When they are making some decision and when they are taking such decision of budget cutting, they need to involve us in that round table to speak with them, to engage with them, to say if you are doing such budget cutting, what an impact can make. So we need to speak about that. If you speak about budget cutting in South Africa, you speak about now we are having more vacant position in Department of Health or in clinics, in hospitals. So if you speak about budget cutting, it means those vacant positions, they will remain vacant. If you speak about budget cutting, it means those hospitals that they don't have all the equipment, your Genie Expert machine, your TB urine testing machine, you won't have it. They won't have money to do that. So the budget cut, it means a lot to us. It means number of things that need to be available at facility level. You won't get it. We are speaking about it. TB prevention therapies for people living with HIV and AIDS. If you do budget cut, it means you won't be able to enroll people on TPTs. If you speak about budget cutting, it means you won't be able to enroll people on the BPAL. The BPAL is it's a new regimen for MDR-TB that it can treat MDR-TB within 6 months. So it means a lot of things. So the fourth issue is about strengthening political will. We need the political will, especially from the Deputy President as the chairperson of SANAC, to ensure that this budget cut doesn't happen. And also, when we need to come together with them, to have meeting with them, they need to avail themselves. So part of our march was to say to them, if we need you guys, come and meet with us, because we need to meet with them, as they promise that they will respond within 14 days. We hope that part of the things that they're going to put on their response is to give us the date and time to say, let us on this day and this time meet and discuss this issue further, so that we bring on the table what we have, what is our concern around this issue, and then we find amicable solution. Because if you look now, we are speaking about TB recovery, that is there, but we see the poor implementation of such TB recovery. Because in 2020, during the COVID time, many programs of TB and HIV were disturbed, many programs of TB and HIV were suspended. So we see those gaps. That's why we still experience more death happening with TB. Hence, we are calling the national government to say, let us declare TB as a public emergency.
Yeah. Now, you just poignantly painted out what these budget cuts actually mean on the ground as well, and also, raised these alarming figures of 54,000 people dying annually of a disease that is actually treatable. But do these budget cuts mean that these 54,000 people dying annually of a treatable disease will increase?
If we do the budget cuts, it means because we are short-staffed in terms of dealing with TB, as I was speaking about the TB recovery plan. So when we speak about the TB recovery plan, it's a plan that seeks to re-engage those who are disengaged on treatment. So if you do budget cuts, who are the people that are going to look for those that are disengaged on treatment? And people, when they disengage on treatment, especially TB treatment, they end up having MDR TB. And when they have RTP, it becomes expensive to treat such people. So like now in South Africa, if you look at the stress that we have, we've got about around 11,000 people that have got MDR. And when we look at the BPAL that can treat MDR within 6 months, we've got about 6,000 people. Then you ask yourself, how are we going to ensure that the other 5,000 people that are not yet on the BPAL regimen, how do you put them if you're doing the budget cuts? So basically, it means we are moving forward. We are reversing what we've been, all the achievement. We did well with TB. If you check from between 2015 and 2024, we did well with TB. But if we start to do the budget cuts, and it means we are reversing all the successes that we've been doing. So what we see in 2020, where everything that we've been doing started to reverse, and then it's going to get to that point. So that's why we don't need the budget cuts, because we don't want to reverse the gains that we've been doing on TB. We know TB is one of the most deadly diseases that kill many South Africans, especially for people living with HIV and AIDS, are dying because of TB. So we need to also speak about the TB prevention therapies, like the 3HP, where a person can take 3HP to avoid being infected by TB. We know that TB is a global issue, but we as South Africans, it becomes a public emergency for us.
And we certainly can be doing more when it comes to that. Now, as a treatment action campaign, you've advocated for HIV/AIDS ARVs, and there was a difference in government stance from the 90s to where we are now when we look at ARVs. Nqobile, do you feel that you're on a similar uphill battle when it comes to TB now?
Indeed, when it comes to TB, we feel like we are around the 2002, 2003 when people were dying, because this is the year that we remembered people dying because of not accessing treatment. So if we do have these budget cuts, it means we will reach a stage where we won't be able to put everyone on treatment that is diagnosed with TB, especially the main concern when we've got the MDR TB. If we can't put everyone that got an MDR TB on the BPAL, what does it mean to a country? Because if we put them to the other regimens of TB, it can take up to 24 months to treat MDR TB. But we don't need people to take 24 months to be treated for MDR, but we need people to be put on the BPAL that they can be treated in 6 months. So that's, and when you speak about the BPAL, it's too expensive. If you remember, not long ago, as Chasey, we're advocating for the reduction of bedaquiline, to say bedaquiline must be cheaper, and then it becomes a cheaper price, because it was around 5,000, now it's around 2.5. So you see, if we speak about putting people on the BPAL regimen, how do we put people on the BPAL regimen if it's so quite expensive? It means the 5,000 that is not yet on the BPAL regimen will remain not on the BPAL regimen, and it means you need to treat them for 24 months. And when you try to treat someone for 24 months, we can experience death within the 24 months. It's very difficult to take TB treatment for 20 months. It's a very difficult situation to do that. So that's why we say we really feel like we are at the uphill that we faced around the 2002, 2004, when people were not put on ARVs. Because now we've got people we've got the best medication like the BPAL, but we cannot put people on the BPAL. We need people that have got MDR to be put on the BPAL. We need people living with HIV and AIDS to be put on the TB prevention therapy, so that they might not get infected by TB. So we need to do that. So when we are saying prevention is better than cure, then these are the things that we need. If people living with HIV can be put on the TPTs, and then it makes things better, because we know that TPTs is also expensive, the 3HP is expensive, the 3RH is expensive. So we need people to be put on such TPTs so that people can have this right of not getting infected by TB. So we need the TPT, but for people to be put on TPT, we need good budget, we need good personnel, we need everything, good people also to be there, because when you speak about TB, you must speak about also the adherence, because if you don't speak about treatment adherence on TB, then that's where we experience also issues of having people that they are diagnosed with MDR.
Well, Nqobile, we hope that in the next 40 days, when government does come back to you with your list of demands, that those budget cuts will be re-looked at, because they're so desperately needed. Thank you so much for joining us this evening and for sharing your insights with us. Now, that was Nqobile Shabalala, who was the capacity building coordinator at the Treatment Action Campaign.